Eildon Housing Association were set up in 1973. We provide social housing. We have in the region of 2,200 properties at present, but quite an ambitious new build programme over the next 5 years where we're hoping to increase our social housing properties by 750. Well, the majority of the area we operate is rural, and that does create challenges for us in terms of supporting our tenants. Many of our people find that they're quite remote. You know, there's not the infrastructure and services that they require. Transport is a real challenge for us, and it's actually a challenge for us in terms of recruiting staff for our care service. We have a service in Station Avenue in Duns. We provide services to 14 adults with a learning disability. 11 of those individuals are also tenants of Eildon and live in supported accommodation. And we provide care and support 24/7 every day of the week.
We're a care and support at home service for adults with learning disabilities, and from this base we also provide an outreach service to people with learning disabilities in the wider Borders community. We provide a very diverse range of support and care services, from somebody who needs a little bit of visiting support to do their shopping on a weekly basis to 24/7 hands-on personal care for people with a greater degree of disability. Everybody lives in their own tenancy here. We have some single tenancies where people live alone independently, and some group shared houses so that people can share with other people with disabilities. We have what we call a Windplan procedure here, which all of our service users helped us to make up. It's all about person-centred care. It's a very outcomes-focused procedure, and we look at people's individual requirements and what they would like to achieve in their life. And in particular, one of those areas is their social life and their health and well-being. So we would look at what they were interested in, how they would want to be supported to achieve those outcomes.
I go to Bachcha every Friday in the month. I go with some of my friends from Station and meet with others from around the Eildon and Duns area. Any disabled person can play Bachcha, as there are different types of equipment that can help them play. I really enjoy getting together with my friends, and we are loud when we start cheering.
So Amanda goes to the community choir on a Monday night, and you've made lots of friends there, haven't you? And what happens is that we plan it on a weekly basis. So if Amanda still wants to go every week, the support worker asks you if you want to go, doesn't she? And then you and her go in your car together.
We go all together.
Sometimes it's different support workers that go with you every week, isn't it? But you still go every week.
I still go every week.
There is definitely a link between service users' well-being, mental health and physical well-being in terms of their connectedness to the community. We're so well integrated as a service here into the local community that you will often see our service users walking up the street and everybody knows who they are, they'll speak to them and they'll become part of the local community. And that obviously has a huge positive effect on somebody's mental health and well-being.
Part of our role is to work with tenants in terms of their social inclusion and to support them to be socially engaged. And that's very much a service we think we could develop across the borders. We know from speaking to the learning disability team that there's unmet need across various parts of the borders. We've got a good track record in supporting people and can deliver that same service to enable people with learning disabilities to live in their own homes in the community but still be part of the community that they live in. So it's how we can support those individuals to remain at home as long as possible, addressing their health and social needs, but also any areas around social isolation that we can support.